Hi, welcome to the Honey and Harry Show. I'm Honey,
And I'm Harry.
and today we have a guest on who is a holistic dentist. She is actually my godchild's fiance. Um, it's Dr. Erin Wilbanks, and she is actually a dentist in North Carolina. And Erin's been in our family for so long. I feel like they are married already. So I'm so honored to have her on. Hey, Erin, this is Erin. Hi, Erin.
Hi, thank you guys so much for having me. I'm
Oh,
excited.
Absolutely. And, Erin has always, since we met Erin has always been so passionate about holistic health, just health in general. And of course, she's a dentist, so she's passionate about the teeth and all that. But like the whole, not just your mouth, like your whole body. I just love the holistic approach to medicine. Absolutely. So, Erin, you work for a holistic dentist, right? Or you're the dentist, but you work for a
Yeah.
practice. You're part of the practice, right? And
Right.
so can you explain to people, because I think people don't really like when they hear it, they don't, because I know, my ignorance, even I didn't understand the holistic approach. You were kind of leap years ahead of all of us in Baton Rouge, all those years ago. But now that I'm starting to learn more about the holistic approach, it's the better approach for me. I think personally, I truly do. So why don't you give us a little bit of what that even means? Because I know people don't understand that sometimes.
Yeah, absolutely. When I wanted to go into holistic dentistry at the time, I didn't even know what the name was. So I think, some people say holistic dentistry, biologic dentistry is another
Hmm.
term, functional dentistry, integrative. It's kind of all meaning the same thing. And I think we all kind of have our own definitions, but the biggest key is that it focuses on that oral systemic connection. So for so long, medicine and dentistry have kind of been this like, there's been this separation, and everyone's kind of treated their oral health in the oral cavity like it stands alone. And we know that that's just so not the case. So the biggest thing is bringing in that connection. And when I look at someone's mouth, I'm looking at their mouth and saying, what can I see in their mouth that could be playing a role with some of their systemic issues or even signs that something systemically is going on that they may not be aware of? And then vice versa, if someone's coming in with some type of sickness, what possibly in their mouth could be playing a role to exacerbate that problem or prevent them from healing? There's a lot of toxicity, there can be infections. So we kind of want to bring the mouth to this biocompatible and biomimetic state so that the body can heal.
I love that. And also I did forget to mention tonight we're gonna do our. We've never done this before, but we're gonna have. You have a question for Erin, Dr. Erin. She would love to answer. I know you would love to answer all the
Absolutely.
questions. Definitely. But no, I like that, like how you're trying to figure out everything because there's like your health in your mouth is so related to your heart, just to everything. It really is. And I didn't know that until maybe the past 5 years. Isn't that
Yeah.
crazy? And you've
Yeah.
educated our family hugely. So I want to ask a question of you. Tell us,
Yeah.
because I'm very confused, because back in the 90s, I got the Kentwood water jug and I got the fluorinated water, thinking I'm helping my children. So
Yeah.
give me some background. I do not understand it. So we have you
Yeah.
to explain, please.
Fluoride is a very hot topic. And traditional dentistry is very pro fluoride. Um, Holistic dentistry is very not so much fluoride. So I personally don't think that fluoride is necessary. It is not an essential nutrient. It doesn't have any function in the body. If you notice on your fluoride toothpaste, you'll actually have a little poison control label on the thing of
Oh,
the tube
wow.
saying, if you swallow it, please call Poison Control Center, because it is
That's
really
crazy.
toxic at high doses. Now, I will say there is a difference between topical fluoride, so meaning like toothpaste fluoride, and water fluoridation. So if you think about water fluoridation, basically it started in the 1940s. The early studies on water fluoridation, so people people say that it's like one of the biggest public health services to exist, and I completely disagree because whenever it first came on the market and they did studies, the studies were really, really flawed. And there's actually never been a randomized controlled study that has shown the effectiveness of water fluoridation. So if you think about that little poison control label and you think about the amount of fluoride that can be swallowed in the water, there's no dose control. So we're essentially drugging our water, and a 300-pound man drinking tap water could be potentially drinking the same amount of fluoridated water as an infant who is having to drink formula, and mom and dad are using tap water to mix with the formula. If you think about how susceptible and how small that baby is compared to this 300-pound man, there's no dose control there. We don't know if how much fluoride that baby is ingesting. So they
Wow.
actually um, used to have a max cap at like 1.2, I think it's milligrams per liter, was like the max dose in water. And they, in 2015, brought it down to zero point 0.7 because of all the fluorosis, or basically fluoride uptaking in the bones. People were having negative side effects, so they had to bring it down. The type of fluoride, the last thing is the type of fluoride that's in the water fluoridation. It's a completely different type of fluoride than what's in the toothpaste. So the water fluoridation, it's a fluorosilicate, which is actually waste from the fertilizer industry. So basically, the fertilizer
Wow.
industry has this waste, and then they're going in and dumping it into the water, and we're ingesting it. So it's water fluoridation, in my opinion, there is absolutely no reason. And I do believe that at one point, I think it's about 65% of Americans have fluoride in their tap water. And I do believe at some point in our lifetime that'll be gone, hopefully.
Hopefully, yes. And I know I know when we were like when my kids were young, it was like you wanted the fluoride in the water. It was so
Right.
weird. It's so weird now. And I'm like, oh gosh, can't catch a break. But anyways, and this being February dental month, that's why we kind of had you on too, because it is the dental month in February. So give us some ideas for some preventable care that like for children. Like, okay, because I have grandchildren, and when I was a young mom, went to the dentist twice a year because the insurance wouldn't pay for it. So why wouldn't you go? And I made sure they're brushing their teeth at night. They had the little things that they could floss with. That was fun because it was on the little stick, and they did that. I mean, are there other things that we should be doing for our small kids and adults too? Like, what should we be doing? Some preventable care where you don't get the cavities and the this and the that, all this stuff.
Yeah, one thing I will say that's really frustrating in the holistic world, we have a lot of parents that come to our office and their kid may have cavities. They're seeking a second opinion. They went to a traditional office, they didn't feel comfortable. And I see it so often now with dental providers, and it is one of the most like gut-wrenching things is there are dental professionals out there shaming moms for not using fluoride or saying that breast milk causes cavities, and it is so frustrating. Um, Fluoride is not a silver bullet. If you use fluoride, your decay is not just, yes, it can help prevent, but there are so many other things that we should be looking at for prevention. Um, One, diet is so huge.
Mm-hmm.
We really need to be encouraging our kids and even adults to be eating a rainbow. We want a well balanced diet, and that's gonna really be more whole foods. We want to try to get away from the ultra processed stuff. We know it's not good for our bodies, and it's definitely not good for our teeth. The worst culprits, I will say, especially for kids, are going to be the little starchy carbs. Think like your goldfish, your little crackers, things like that. they're going to kind of sink into the grooves of the teeth, and that starch and that the carbohydrates are just the perfect food source for the bacteria to
Yes.
start to create acid on the teeth. So really trying to limit those processed things. Another big thing too is it really comes down to time under acidity. So our teeth are either in a remineralization phase or a demineralization phase. Demineralization is when the enamel is breaking down, and that's when the cavities start to form. And that's when we're acidic. So we really want to focus on being alkaline. So if you think of someone who is, they have their breakfast, they have their lunch, they have their dinner, they're not snacking kind of consistently through the day, or they're not having an iced coffee with sugar that they're sipping on through the day. We want to give our mouth time to recover from what we call acid attacks. So, after we do have, a meal, or if we do have something sugary, say your kid has has a little snack, and we want to make sure that they're drinking a bunch of water after to kind of bathe and get rid of the little things that are stuck. But then also like giving time. We don't want to be just consistently all day, because then we're kind of always under that acid attack. So diet's going to be really important, and also nutrient deficiencies. So many of us are vitamin D deficient these days. Vitamin D plays such a huge role with oral health. Most of us, kids included, need a D supplement. So if you feel like you're doing all the right things, and you and your kid are doing all of the right things, but you're still getting cavities, maybe get some blood work and check to see if they're nutrient deficient. I take a good vitamin D3 K2 supplement. You want to make sure, if you are supplementing that D3, that you have the K2 with it, because the K2 actually helps the D absorb.
Okay.
Another thing most of us are deficient in magnesium. Magnesium is so, so, so important, as well as omega 3s and trace minerals. So we want to make sure that our saliva has tons of minerals in it. Our saliva is a superpower. Our saliva really helps prevent the breakdown of our enamel. And so if we have those minerals in our saliva, it's really, really going to help. So we want to have good saliva flow, all those things. And besides, brushing, flossing, um, breathing is something that I personally believe is the number one cause of cavities. We really need to shift back to nasal breathing. Um, I see so many kids, and kind of like the new normal, I would say, is these kids, they come in, they have stuffy noses, they can't breathe out of their noses, they're mouth breathing and their mouth is wide open. They have asthma, they have allergies, they have ADD symptoms, they have dark circles under their eyes, they're not sleeping, they're bedwetting. This is the new normal, and these kids are sick because of it. So mouth breathing, I think, is a huge missing piece that a lot of traditional dentistry isn't looking at.
So you think like the mouth breathing, because like Dad, that was one of your questions. I'm going to let you go from there.
No, I was just asking that because I have a deviated septum, which I'm not going to go get surgically corrected, but at this
Mhm.
point,
Mhm.
and so if I'm very relaxed, I do end up breathing through my nose, and it works fine. But other times, doing a lot of mouth breathing, so I'm just curious as to the
Yeah,
effect.
is that bad on the teeth too?
Absolutely.
Yeah.
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 It plays a huge systemic role, but locally with your oral health, I just mentioned the saliva and having that good saliva. Saliva flow is so important. We have enzymes in our saliva that break down the bacteria that cause cavities. We have minerals in our saliva. So basically, we need to keep good saliva. And when we are mouth breathing, we're drying all of that out.
Right.
So we're
Yeah.
kind of stripping your defense mechanism against the oral microbiome, the cavities that are, or the bacteria that cause cavities that are there. So it dries everything out, and then it also, when it's dried out, creates an acidic environment. And again, we really want to get back to alkalinity. So that acidity can definitely increase your risk for cavities and also gum issues as well. Not to mention also inflaming the throat. So making the tonsils larger. You see a lot of kids these days are having to get their tonsils taken out, or even, it's historically been for a while, but mouth breathing is going to make the tonsil size larger and then can obstruct the airway even more. So,
It's so crazy that it's just so. Because I mean, yeah, I mean, kids. I feel like nowadays kids are always sick.
yeah.
They're all just sick all the time. So how do like so you have a child that comes in and has a cavity on a baby tooth.
Hmm.
How do y'all treat that? Because I know, do you do the silver? I mean, I don't know much, but I know like a lot of dentists are kind of staying away from that now, the
Hmm.
traditional fillings. I don't know if you treat children different than you treat adults, baby teeth versus the big teeth. Maybe you can explain all that because that can be a real confusing. I mean, again, we're not dentists, and we're just not. Nobody wants to go to the dentist.
Trust
I
me.
mean, really. I mean, I'm going to be honest with you. I sit in the chair and my heart pounds out my chest every time. I think when they start taking the x rays, I'm like, oh my gosh, I know something, I have something bad. I know it's going to be bad. And it's never anything bad, but like, it freaks me out beyond belief. So like I start catastrophizing of all the things that it can be waiting on the dentist to come in after they clean my teeth, and I'm okay to go. You know,
Yeah.
I'm just a crazy person. But anyways, how do you treat maybe that's a big I guess it's a loaded question. The children, adults, the type of feelings, and then maybe what do you do for the kids? Because if maybe they don't get as anxious because they don't know. Maybe their ignorance is bliss, right? I don't know.
Yeah, I will say that that is one of the toughest things about dentistry because it is a very, you're kind of dealing, people are so in a sudden heightened state of anxiety. There's a lot of anxiety. It's uncomfortable or sometimes painful. It costs money. There's a lot of just fear and anxiety, and it can be really difficult, especially because a lot of people have traumatic childhood experiences. So that's like my biggest thing when I am treating a kid or working with a kid. I want to make it as pleasurable as possible, even though it is going to be a little uncomfortable. There are so many terrified adults because of experiences that they had when they were kids. And sometimes that scares adults off to where they don't go to the dentist for, 15 years. And I never want that to be the case. So I think as a parent, making sure you are finding a dental professional that you really feel comfortable with, and you trust and is very nurturing and patient. Unfortunately, there's a lot of corporate run dentistry places now where they really have to kind of get people in and out, and it's almost like an assembly line, and they're not able, unfortunately, to spend a lot of time. So somewhere that feels comfortable as it can be for you. And with kids, I think a lot of times, honestly, it is the parents' anxiety that can rub off on the kids. So as a parent, I always tell the parents, because if I say, hey, your kid has a cavity or a couple cavities, we're gonna have to treat them, and then the parent immediately goes, oh, so they're gonna have to get a shot. Oh, so it's gonna hurt. There's gonna be pain,
Oh my
and I'm
god.
immediately like, don't say those words. So really, as a parent, if your kid does have to have treatment, make sure that you're being positive about it. It's really their mindset. You wouldn't even believe how many times the parents like, oh, this kid, I know him, there's no way he's going to do great. And then I bring the kid back. They don't even flinch when I give them the shot, because the way, it's just all about the way you approach it. You tell them, you show them, you do it. There's a lot of different techniques there, but as far as the filling materials go, we were kind of briefly talking about the silver fillings, or the mercury fillings. I call them mercury fillings because they are mercury fillings, and that
Okay.
was actually the reason why I got into holistic dentistry, because I was kind of going through my wellness journey while I was in dental school, listening to a lot of podcasts and just nerding out. And so I was starting to buy organic food and, look at my personal care products and just trying to bring my toxin load down. And at the same time was being taught in dental school that it's really safe to put these fillings in people's mouth that are 50% mercury. And I'm like, this doesn't really align with my beliefs or my lifestyle. And so the mercury fillings were what kind of got me into this whole world. And then it just blew up into even more than that. But the good thing is, yes, that most providers are not still using those mercury fillings, um, especially in children, and they really shouldn't, because the FDA in 2020 put out a statement that mercury fillings, these amalgam fillings or silver fillings, should not be used in pregnant women or children.
Oh, wow.
Um, because the mercury can, even in a pregnant woman, pass through the placenta, and a lot of babies are born with some of their mom's mercury load. And so they're, as soon as they're born, they already have this heavy metal, load from mom's mercury
Have a question.
fillings, which is so crazy.
We can take it later, though.
Oh, we have a question, Erin. I'm so sorry. I don't mean to
Yeah,
interrupt
no,
you.
go ahead.
Can we?
It's a good
I
time.
want to get to that.
Can you see that, Erin?
I can, yes. What is your opinion on oil pulling? So I love oil pulling. We were talking about mercury. The only time that I think oil pulling, you shouldn't do it is if you have mercury fillings. The reason why is the oil will actually pull out more mercury vapor from the filling. Um, so you don't want to do it if you have mercury fillings, but otherwise, I love it. It doesn't replace flossing, it doesn't replace brushing, but it definitely has a place. It's an old Ayurvedic technique that's been around for hundreds of years. Um, Coconut oil, which is typically what it's done with, is antibacterial. It's super nourishing for the gums. So it's a really great adjunct therapy to use in your oral hygiene routine. You can swish for about 10 minutes or so, spit it in your trash, and it's definitely going to be really nourishing for the gums. There are a lot of like crazy claims that it can like completely reverse cavities or, whatever. And that's not true, but it definitely can improve oral health. So I think definitely using coconut oil, it's an inexpensive way to really improve your oral health. So I think it's a great practice.
Oh, wow. I didn't even know that. Somebody's asking a
Hmm.
question. I had no idea. That's pretty good. So, if you do, so there are, and I've seen kids that have the silver, like
Yes.
baby teeth. They're not supposed to have that, right? That's
So those
dangerous.
those are actually stainless steel crowns.
Oh, that's what that is.
So they are a little different. Personally, in the holistic world, we're metal free, so we don't do any of the stainless steel crowns, but it is certainly not toxic like
Okay.
mercury.
Okay. So
So
I'm confused on all that. It's just so
yeah.
confusing when you don't know. And also Lindsay wanted me to ask a question. She's running around with Pearl, but she has a permanent. She sees Dr. Cave, who we're um, Erin knows who Dr. Cave is. I'm kind of into functional medicine. I have a function medicine doctor. I have we see holistic. I mean, it's just a whole body approach, right? So Lindsay has the permanent metal retainer
Mhm.
in her mouth, in the top at the bottom after getting braces. And there's some controversy whether she should keep them in or not. I think Dr. Cave said to get them removed. I don't know if it's good to have metal in your mouth, but we really wanted to ask a dentist that
Mhm.
was, that this is your thing. So maybe you can address that because a lot of people have those now.
Yeah, I will say again, the good thing about it is it's not, it doesn't have mercury in it or any
Okay.
really heavily toxic metal. Most of the time they're like a nickel titanium. Sometimes they can be like a stainless steel. Um, it's really up to the person. I don't think that they necessarily cause anything.
Okay.
Um, but for someone like with Lindsay's health history, it may help to improve some of that burden. You know what I mean? I think maybe taking them out and switching to like a clear retainer that she could take in and out at night.
Sure.
One of the reasons why I don't love them, even just besides the metal, is that they typically trap a lot of plaque and calculus and tartar too. So sometimes it can actually bring up some gum inflammation as well. So I'm not a fan of them, but you just kind of have to. Some people are so worried about their teeth shifting, and that's the only thing they care about. So you just kind of have to weigh some, the pros and cons there, because you can have some risk of shifting, without having them completely splinted together.
Yeah, and nowadays they have the clear guards, I want to say.
Mhm.
You can just get that like it's like I guess it's not Invisalign, maybe it's something like an Invisalign where you just invest and you just keep it, right? Something like that
Yeah.
would be okay. That would be fine
Yes.
because I think I'm thinking she's getting them out. So,
Yeah.
and I want my other kids to get them out too. So we might as well, just all go together and do it. So,
Yeah.
anyways, Dad, do you? Because I have more questions, but he's not saying anything, so I'm hogging the show.
That's okay. That's okay. I had a few things in my interest. I went. I had a lot of dental trauma fear from childhood. Back in my day, uh, they had foot operated drills.
Oh,
They used sandblasting to get inside your mouth and clean things up. And so I went at least one time 16 years between dental visits. And of course, I had a
Wow.
mouthful of issues at that point. And so when I went back, I had such a fear that I I elected to have sedation dentistry done early on in that reclamation project. I stopped doing that at some point because it became something that I didn't feel I needed anymore, and it was actually a little aggravating. Do holistic dentists do something different than regular traditional dentistry regarding sedation dentistry?
That's a great question. We actually don't. It's pretty much the same thing. So everyone has different, fear levels and anxiety levels, and um, also with different providers, sometimes certain providers can make people feel more comfortable or less comfortable, and it's a relationship. You're not gonna. I always tell people finding the right provider is almost like dating. So we do the laughing gas sometimes. We still do the oral sedation. I will say I don't do it super super often, but we still do it, and it's pretty much the same.
no, and you're so right about like when she said about the relationship you have with your dentist. It's
Mm.
the weirdest thing. It is because I don't know why it's such it's a thing, but like I love my dentist. I love her because she's nice to me, and I like and also like the dentist that's with her because they're just kind and they're sweet, and the way they treat me. You know what I mean? They're very sweet, and I think, like you said, that has a lot to do with it. Like, but I didn't have childhood trauma. I had healthy teeth my whole life, and I had a great dentist. So I don't know why when I got older it became a thing after, and that's one of the things I wanted to say. After, I never had a cavity until I got pregnant. And
Mm.
then every pregnancy I got one. Is that a thing? Is that normal? Do you hear that?
Absolutely. Pregnancy changes so much with your mouth. It really, the hormone fluctuations, sometimes people actually can find out that they're pregnant after a dental cleaning because there'll be such a significant change in their gums. So you typically have a lot more, we call it pregnancy gingivitis. And so there's a lot of changes. The hormones play a huge role with the gums and the teeth, and it completely changes the balance. Also, a lot of times when you're pregnant, you're nauseous, you're throwing up, a lot of those
Yes.
systemic things can affect. So yeah, absolutely. We see people after pregnancy and a lot of things change. So yeah.
And that happened for Lindsay. I'm sorry.
Go ahead.
There's a question again.
A Facebook user says, "Do you use sealants?"
Hmm. Another hot topic. There are holistic dentists that do sealants. I personally don't. Um, a lot of times I see sealants that are either done poorly or they've just over time worn away. And sometimes you'll have little pieces of the sealant lose their seal or lose their kind of connection with the tooth, and a piece will come out, or you'll have a little kind of catch between the tooth and the sealant that can actually be more of a plaque trap or a food trap. And so you can sometimes even increase your risk for getting a cavity there if
Oh,
that
wow.
happens. So I'm not the biggest fan. There are a lot of people that do it, and unfortunately, I see a lot of questionable business practices because it's a good, easy money maker. Insurance will pay for it. So sometimes it's just kind of like, oh, why not? Let's do a sealant. But I personally am not a fan. But again, you just
Yeah. So the other
drove
thing
so.
I wanted to ask is, you know, my daughter, I mean, Erin knows, I had cancer, breast cancer. She got chemo, and you know, that really changed her health in her mouth.
Mhm.
Um, so I mean, with the holistic, do y'all have patients that are cancer patients or were cancer patients? Because that's, you know, that's another thing. You got to find somebody after that happens to you. You know, I mean, your oral health changes completely.
Absolutely. Yeah, I will say with that, we have a lot of people who, even just besides cancer, will have a lot of other chronic diseases. And um, sometimes with those people, I mean, you're more immunosuppressed, you're more susceptible to things. Um, Someone like that is going to have things in their mouth, conditions in their mouth can be affecting their health more than someone who may be like quote unquote healthy. So we have to really look at the mouth and see if there's anything there that could be making that problem worse, or increasing their risk for things. So hidden infections, I see so many people walking around with infected root canals.
Oh, wow.
We'll have people will get root canals done on their teeth, and with a root canal the whole living part of that tooth is taken out. There's no more nerve supply, there's no more lymph system. And so basically the tooth doesn't have any more defense, and there's always going to be some low grade level of bacteria living in that tooth still. There's always going to be some low grade level of inflammation. And a lot of times that bacteria will continue to proliferate and cause a secondary infection, or an infection again in that root canal tooth. And unless you're monitoring it closely, you don't have any symptoms typically, because you don't have any nerve inside that tooth anymore to tell you, to give you pain, to tell you something's wrong. So we do a lot of what we call cone beam x-rays, or CBCTs. It's a 3D x-ray where you can really take a deep look at those root canals and see if there's infection there. So someone with cancer, absolutely, we're taking a look to see if they have any infected root canals, because that can play a huge role in that inflammation. And we talked a little bit about saliva flow. I mean, people who have radiation and some of the medications that they're on can really impact their saliva flow. So they're going to be more high risk to have problems. Um, so, yeah, I mean, it's absolutely critical to make sure that, what's going on in the mouth is going to be not contributing to that chronic inflammation and infection.
100%. And I know you've told me you suggest not doing a root canal, right? Is that right? Or
Yeah.
I don't want to misquote you. To do an
Yeah.
implant,
Yeah.
it's the
Absolutely.
safer.
It is. It is. And there's some nuance to that. Like for instance, for kids, say a kid has a fall and busts their two front teeth out, and their only options are root canal or extraction, but they're still growing, and so they're not old enough to be able to get an implant yet. So in those instances, I'm still saying, get a root canal, buy yourself time, because if that tooth's gone, the bone's going to shrink, and then by the time they're old enough to get an implant, there's not going to be enough bone there to even hold it. So those are the pretty much the rare instances, but I feel blessed that in the holistic community, our patients are already so educated before they come in. They come in, they know what they want, and most of the time, it's not even a conversation I have to have. They're like, "Oh, I'm not doing a root canal."
Well,
They're
that's
gonna
part.
go
Yeah,
direct.
no, that's why they're coming to you, right?
Yeah,
No, that
yeah.
is. So
An
that's good.
implant
So
is a more biocompatible option, and the great thing is that implants, they last a really long time, and they're a really good replacement option. So yes, I typically will recommend implant over root canal for sure.
yeah, because I'll text her and ask her questions sometimes about all.
There you go.
All
That's good.
right, wait, well, I'm get to one of your questions,
Oh,
Dad. I'm
okay.
sorry.
My one remaining question is, do you recommend or not recommend the use of mouthwashes? And if so, what kind would you recommend? I know I used to use an alcohol based, and then I realized that was probably not the best thing to do. So I'm using one that's not alcohol. But your thoughts on that, Dr. Wilbanks?
Yeah, it's really interesting you asked that because I've been kind of on the anti mouthwash train for a while, and they're having a lot of studies coming out about actually some of the systemic issues that mouthwash can potentially cause, including high blood pressure and even erectile dysfunction. So there's a lot of really interesting things there. Mouthwash, if you think about the feeling, you pour some Listerine and you're swishing it around. You have that like insane burning, sensation. And like if you're feeling that burn, that's a sign that it's not really what you want to do. So I like to focus more. Mouthwash is kind of like an antibiotic of the mouth. If you think about it, it's just nuking everything and killing everything. And so what I like to focus on more is nourishing. So we're talking more now about the oral microbiome. So just like the gut microbiome people have been talking about for so long now, the mouth is the start of the gut. And so we have these bacteria that live in our mouth, and we want to make sure that we're balancing and we're allowing the good bacteria to outweigh the bad bacteria. And when we're kind of nuking everything, like with the mouthwash or really harsh ingredients, we're really disturbing and disrupting that oral microbiome. So the alcohol specifically that you mentioned is really drying and irritating to the tissues. So it can actually cause some gum irritation and inflammation. And it also, again, that acidity alkaline thing that I mentioned earlier, most of those mouthwashes are super acidic. So they're disrupting with the alcohol, they're drying all the tissues out and they're making it acidic. So you can actually increase your cavity risk by using those mouthwashes. So I don't believe that anyone needs a mouthwash. So sometimes people, will supplement the oil pulling like we talked about earlier for their mouthwash. There are a couple on the market that I do like that are more alkaline and have better ingredients in them. But overall, for like your daily routine, it's really not necessary.
Yeah, I mean that's good because I've been on the fence with it too with the whole mouthwash. Okay, so the one last question I have two things. The tongue tie. I mean
Yeah.
everybody that's the thing I hear all the time with babies and explain that because I'm going to explain it wrong if I say anymore. So explain the tongue ties and what do you do with that and what does it even mean? I think people need to understand that.
Yeah. So tongue ties are so common now, and there is a big genetic component. So what a tongue tie is essentially we all have tongues, and then we all have this band of tissue underneath our tongues that connect the tongue to the floor of the mouth. And everyone's anatomy there is a little bit different. So some people's connection is more restrictive than others. And so it all starts with breastfeeding. So you see a lot of, you know, newborns that are struggling to breastfeed. So I always recommend getting a really good lactation consultant to have them evaluate for a tie early on and to help with the breastfeeding process. Um, we know that the best baby is a fed baby, and so there's definitely no shame in saying this, but breastfeeding is definitely going to be better overall for the baby's oral development. and their suck and swallow pattern than bottle feeding. So if you can breastfeed, it's really so beneficial. So, but sometimes if the tongue is too tight and the tongue isn't able to go up and form a latch, or even a lip tie, sometimes we can have a little lip tie here that makes it to where they can't form that grasp on the nipple. Um, it can cause some problems with feeding. So sometimes you have to have that tie, that frenum released early on for the baby to even get a latch. The problem is that just because you get it released as a newborn, there's a lot of stretches you have to do after to keep it nice and loose. The reality is that the work doesn't stop there. So the surgical release is part of it for sure, but there is a lot of um, therapy, stretches, exercises that need to be done, and habits that need to be addressed all throughout childhood. Um, so there's what we call oromuscular dysfunction disorders. And so basically how we're using our tongue and our lips and all of our facial muscles, most of us have dysfunction there and we're not using them properly. And sometimes it can come from ties and sometimes it can come from other issues there. So there's a whole host of different issues besides breastfeeding. And sometimes kids with ties can even actually breastfeed well, but then we don't catch the issues until later on in their childhood because there's different varying degrees of severity. Um, so for kids, for instance, some typical signs of a tongue tie: big gag reflex, messy eating, mouth breathing, not sleeping well, teeth grinding, um, food aversions, being a picky eater, sleep disorder breathing. And then kind of moving into adulthood, adults with ties typically have a lot of chronic neck and upper shoulder tension, more forward head posture, again with the gag reflex, but they're going to be more prone to have sleep apnea. Um, Tension is really, really the biggest thing though.
Oh, that's so crazy. Just from that. I mean, it's just they're learning so I mean, y'all have learned so much. It's crazy. So before we
Yeah.
get off, can you just like give us some tips of ways that we can unless you had another question. I'm
No,
sorry.
I'm good.
No, you're okay. Okay. Some tips of what we could do like right away to start, better health care for our teeth.
Yeah, one thing I did want to mention that I was kind of going on my anti-fluoride train. Oh, sorry, my little light is going out.
Oh,
Um, you
that's
can't see me as
okay.
well. Um, I really am obsessed with this new line of products that are out that are containing nano hydroxyapatite. So there are a couple toothpaste brands that I love and use. One is called Boca, Boka. One is called Risewell, and one is called FYGG. It stands for Feed Your Good Guys. So what I really like about those toothpastes is that they're natural, so they have clean ingredients. They don't have a lot of those harsh foaming agents and things that can be more inflammatory, but they also have nano hydroxyapatite. So hydroxyapatite is the mineral that our teeth are actually made up of. Our teeth are 97% hydroxyapatite. And so the studies are showing that this nanohydroxyapatite is almost outperforming fluoride of how well it can help with the remineralization and prevention of cavities.
Wow.
Um, so I really, really love it. I have seen some really impressive results. Um, the thing with it is after you use it, you want to just spit it out. You don't want to rinse with water because you really want those minerals to sit on the teeth. Um, there's been some kind of controversy right now on nanohydroxyapatite and is if it's safe or not. That all comes from the particle shape. So there are some, brands out there that have caught on with the hydroxyapatite craze because it's really booming right now. And they're sourcing their hydroxyapatite from not so great sources.
Oh, wow.
Um, so those three brands I know for sure are sourcing from an approved manufacturer out of Portugal, that's been approved by this regulatory agency in Europe. They did a 7-year study. And so I really trust those brands right there. So I would say in replacement of fluoride, if you're looking for something that's more biocompatible and still effective, I would definitely use that. It's safe for kids and adults. And it doesn't have the little poison label on it, so you can swallow it and be fine.
So kids can that's the good thing. Kids can use this. Yes.
Yes,
I'm gonna
it's
want
great.
you after this is over to put that in the comments so I can
Yeah,
read what it is. So I'm gonna go
yeah,
buy it or order it or where I guess you have to order that, huh? Or is that in
yeah,
the
yeah.
stores?
The thing, it's not as super accessible right now. I do think that Boca is being picked up. I think Target and Ulta might be, if they're not carrying it right now, I think they're carrying it soon, so that can help with some accessibility because you do have to order it online. But I would say as far as toothpaste goes, that's the best. Another thing is if you can get yourself an electric toothbrush, like a
Yes.
Sonicare or an Oral-B toothbrush, it's going to clean so much more effectively than the
Mhm.
manual. You just kind of let it do its thing, and you don't have to rely on that technique. Another great thing with those toothbrushes is they have the timer. So most of
Right.
us actually brush less than 30 seconds if we're left to our own devices.
Right.
So we really want to be brushing for 2 minutes. So let it do its job. So that's something I highly, highly recommend. Also, flossing. I know it's the hardest thing for everyone to get into their routine. But if you can commit to flossing nightly, you will see a huge difference in your gum health. The brush only reaches about 60% of the surface of the teeth. So we really want to get that floss in there to be able to get the other 40%. Um,
I think I'm a weird person because I love to floss.
that's so
That's
great.
great. That's great.
It's like an obsession at night. I'm like, "Arr," and then I go after it, girl. I get
I'm so proud of you.
oh, it just feels good on my and like I can rub my tongue on the back of my teeth.
There you go. There you go.
It's a thing. It's a thing.
Yeah, I
It's
love it.
yeah. Is
You're
there
you're like you're in the 1% there because
Right.
most people
Right.
they don't.
Right.
they don't like I know. I just but it's gross if you don't.
That helps you do it.
I know.
You know, I had a hygienist that I worked with that if someone didn't floss, she would floss for them and then tell them to smell it. So
Ooh.
Oh.
everyone gross out.
Yeah, because it is. It's just so like so gross. And like I'm not gonna rat anybody out, but anyways, I mean there are people that are just I know that are just I'm like,
Yeah.
but anyway, so
Yeah.
well, Erin, thank you
Another
so
thing.
much.
Oh,
You
yeah,
gosh,
you're welcome.
you educated us. I mean, I want you to come back on too, because like we didn't really ask, we didn't really get to like really anything. I feel like I mean a lot, but not like so
No,
much.
yeah, I could go on and on. I did want to say the last thing I would think is huge, 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 and has made such a huge quality change for me is mouth taping. So I think that's also having a moment right now, and people are talking about it. But essentially, I tape my mouth shut every single night when I go to sleep.
What?
So we were talking about the importance of nasal breathing. A lot of times our mouths fall open at night because of some of those oral function issues I mentioned with the tongue and all of that stuff. So if we can make sure that we're breathing through our nose, it's going to change the quality of your oral health, and it's really going to change your sleep too. You're going to get to those deeper stages of sleep. You're going to feel so much better when you wake up in the morning. It's made I can't go to sleep without it. I can't.
Really? So explain
Yes.
that real quick to me. You don't use like you're not using like regular tape. I mean, like, right? What are
Yeah.
you?
Yeah. You could, but if you literally just Google mouth tape, a ton of different brands are gonna come up. My
Really?
favorite, my favorite is Somnifix, Drift. Those are my two favorites. For men with facial hair, there's a really aggressive brand. You're not gonna like, but it's called Hostage Tape, and that's actually the best.
I love it.
That's the best for guys with facial hair because it's hard for it to stay.
Yeah.
Oh, I
Um,
love that.
yeah, so that is like one of the biggest hacks you can do. I mean, I can tell such a big difference in my sleep quality with the tape. But for a really cost efficient option, you can even just get like medical tape, like the little roll of medical tape, the little white piece, and just put one little piece vertically right here. And it's very gentle. It's just to keep those lips together
Right.
very, very subtly. And you can, adults do it, the kids can do it too. We recommend so many kids to tape, and a lot of our kids are taping, and it's just really helping the kids sleep better too. And that's going to help their brain health and their growth hormone production and their ADHD system. I mean, everything. It's just it's so profound. I could go on about this stuff for hours.
No, I mean it's so interesting, and I love it. And I mean, I'm telling you, every time I see Erin, even over Christmas, I'm like 47 questions, poor thing. It's like I mean, Lindsay and I just get her and we don't let her go because we have so many questions because she's just always learning the new stuff. And I feel like you're constantly educating yourself all the
Yeah.
time. I feel like you're always just looking to the next thing to better it. I really do believe that. And you're so passionate about dentistry and just the person as a whole. Like you're saying with the ADD, that this, that, all the different things, that's what you want your dentist to be like, because it starts, like you say, it starts here in your mouth.
Right.
So
Mhm.
thank you so much for coming on. I mean, she's busy working all day. I really do appreciate this. I feel like you did me a huge favor by coming on for Aunt Lori, so thank you.
Thank you so
No,
much,
thank
Dr.
you guys.
Wilbanks.
Yeah, thank you so much for having me. I enjoyed every bit of it.
And hopefully we'll have her again.
That would be great.
We can have her again if she agrees to it.
Yeah.
Absolutely, anytime.
All
Oh
right.
gosh. All right. Well, have a good night and
Yep.
Yeah.
Next week we have two guests on, and they're going to talk about cancer, healing, and Medjugorje.
yes.
So tune in to us next Wednesday night. And thank you again, Dr. Wilbanks.
Thank you.
Good night, everybody.
Good night.